Hello, and welcome to the Dementia Dish with Danielle. I'm a public educator at the Alzheimer's Society of Peel, and I'm coming to you today to discuss dementia and depression. So there's something in dementia called the 3Ds. This is delirium, depression, and dementia. People who are living with dementia are more prone to both delirium and depression. Depression is a persistent change in mood lasting at least 2 weeks and characterized by sadness, negativity, loss of interest, and/or decline in functioning. People who are living with dementia, although we cannot reverse the damage done by dementia, and we also cannot stop the disease that is causing the dementia symptoms, we can treat depression. So it's important to be aware of the what depression symptoms look like and to keep an eye out. So what are some of the causes and risk factors for depression? It often has more than one cause, and the causes can vary from person to person. Um, Health conditions like heart problems, breathing difficulties, very often chronic pain and or hormone difficulties can all be risk factors for developing depression. Certainly having dementia or cognitive impairment will put you at higher risk as well. Side effects of medications. Sometimes a side effect can be depression itself. If a person is experiencing a lack of meaningful activities in their day, a lack of social interactions, if they don't have a lot of social support, then they will be at higher risk for depression. We do know that a lack of sleep or a lack of quality sleep can certainly uh, be a risk factor for developing depression. And certainly a history of trauma in the person's past can certainly be a contributing factor to developing depression. So if a person's in the early stages of dementia, if they have depression, it might be directly linked to them worrying about the future. So in early stages, when someone's aware of their diagnosis of dementia, they might start to ruminate and focus on what changes are to come with the progression of their disease. Older people may also experience different symptoms as a result of depression than a younger person might. So what might this look like? They might have more physical symptoms as a part of their depression. So they may complain more of aches and pains and have more somatic symptoms than a younger person might. So there is a link between depression and vascular dementia. So people with vascular dementia often have more insight or awareness into their condition than, say, perhaps someone diagnosed with Alzheimer's disease. And so as their disease progresses, they may keep more awareness and therefore be more likely to experience depression. There are also a lot of brain changes that come along with vascular dementia, that those brain changes, those structural changes may put the person at higher risk for depression as well. So what might this look like? What does depression look like? So feelings of sadness, hopelessness, more irritability, feeling worthless, a lot of disturbed sleep. You certainly might see a change in the person's sleep cycles, either sleeping a lot more or having difficulty sleeping, falling asleep and staying asleep. Physical symptoms, they may complain a lot more of aches and pains. They may be experiencing crying more often, becoming teary, and experiencing diminished joy in the activities that they once enjoyed. So, what can we do to assist somebody who may be experiencing depressive symptoms within their dementia? To schedule an appointment with the person's doctor, physician, to discuss medications because we can treat depression in someone living with dementia. So, discussing what that might look like to help reduce those symptoms of depression, anxiety, and or agitation that the person might be experiencing. Supplying the person with activities to do that are meaningful to the individual during the day can really help. It can help with that sleep. It can help with mood. It can really help to lower those depressive symptoms. And music is a great mood elevator. So we know that to elevate mood using someone's favorite music and supplying that for them can be also a way to alter mood in a positive way. And we do know that people living with dementia, when we have conversations with them that reminisce on their past experiences. So maybe things from the past that were joyful or very positive events. And a way to help distract the person is to bring up those conversations and have the person focus on those. If you'd like to reach out to the Alzheimer's Society of Peel, we do have Facebook, Twitter, and X, Instagram, and we also have a lot of videos on our YouTube channel. So please check those out. If you'd like to contact the Alzheimer's Society of Peel, we can be reached at extension 307 for our service access department, or you can email us at direct.support@alzheimerpeel.com. Thank you so much for joining me today for the Dementia Dish, and I hope that you will join us for other dishes in the future. Thank you.